So today's agenda for our time today, I'm going to start with the need for effective communication with teens, both the need from a professional standpoint and also for parents and helping parents communicate with their teens. I'm going to share some basic motivational interviewing strategies that hopefully you're already using in practice, and then end with ways to engage and coach parents on using these same strategies. I have resources in the handout section if you look at your GoToMeeting panel or the box that's open, so you should be able to download the handouts from there, and I'll be referring to those throughout the webinar. So let's start with the need. If you're not already familiar with the statistic, 3 out of 4 adolescent deaths in the U.S. today are due to identifiable and preventable risk behaviors. So that's a pretty high number of teens that are engaging in behaviors that are harmful to them. The statistics suggest that today's adolescents are engaging in these behaviors at earlier ages and with more diversity. The CDC, the Centers for Disease Control, identifies the behaviors you see on the slide here as contributing most to the serious injury and premature death in teens. And we know 1 in 4 adolescents are at risk for substance abuse, sexually transmitted infections, early unintentional pregnancy, and school failure. So if you think about the patients that you see, or if you have teens yourself and them and their group of friends, 1 in 4 is a lot of adolescents that are at risk. And this is usually where it gets tough. This is where both parents and healthcare providers often kind of throw in the towel before they even ask the first question, because honestly, it's much more comfortable when we don't ask, because then they don't tell us and we don't have to worry about it. But that's the wrong approach to take with teens. When they tell us things like what you see here, like I'm having sex, or texting and driving, I'm drinking with my friends, or I'm feeling like I want to hurt myself, it's very difficult to hear that from teens, and often we're not sure what to do or how to handle it. So then we don't end up asking. A lot of parents rely on us to ask the right questions. Many parents of teens that I saw, or friends of mine that have teens, really want to have their healthcare providers, their teens' healthcare providers, talk to them about their behavior, so that there's another person talking to them that they might respect and be able to kind of hear the information from. But sadly, it's often not the case. So there's a lot of variability in risk screening and talking about risky behaviors with teens. It really depends on the experience and skill level of individual providers, their knowledge of clinical guidelines, their communication techniques, which we're going to talk through today, subconscious biases, like looking at a teen and thinking, oh, I better talk about this with this person and maybe something else with another teen, and just personal comfort level, because it can be very intimidating and anxiety-provoking to talk to teens about sensitive issues. So we know, if we look at studies, that most teens have never been asked directly about their behaviors, and if they have, the questions are asked in a way that doesn't make it easy for them to disclose the behavior. So if you look at the screen on the top, how we ask a question, many times teens are asked, you aren't smoking, right? Or you're not having sex yet. And it's difficult then for teens to say yes, that they are, because you're already assuming by the way that you ask the question that they're not, or that's the answer that you want to hear. So that makes it difficult how we look when we're asking. So we need to make sure we're managing our emotions and our reactions and not appearing judgmental. And then how we talk about risky behaviors is one of the most important pieces. So we know kind of the slogan, just say no to drugs, is not something that is really effective when we're talking to teens about their behaviors. Just think about what happens when someone tells you what to do or what not to do. How do you feel about that? Your immediate reaction is to have the opposite feeling. Like, if you're going to tell me what to do, then I want to do the opposite of that. And then think about being a teen. So for teens, everybody's telling them what to do. Their parents, their coaches, teachers, so they automatically are tuning people out as soon as they start lecturing them or telling them what to do. So it makes it difficult. It's hard as a health professional and as a parent to get through to teens. And what makes it even more difficult is that teens are in different stages of development, and where they are in their adolescent development makes a big difference in the types of risky behaviors or situations that they're encountering and their cognitive and emotional ability to handle those behaviors. So there's different ways to approach teens depending on what stage of development they're in. And we know that there's 4 different changes that happen to them developmentally, categories of changes in their physical development, their cognitive development, emotional, and sexual, and that it's a gradual process. And some of these stop and start, and they might have regression, so it makes it difficult to figure out kind of where they are in development and then start communicating with them in a way that's effective. So in the next few slides, I'm going to highlight some of the biggest changes in each of these stages of development, what to watch out for at each stage, and then I'll be sharing some resources with more specific information that you can use to help parents understand their teens better. So what I hear back from parents is that they never really understood all the different things that were happening within their teen. Obviously, they can see the changes, and once they did understand that, they were more empathetic to kind of the emotions and the different behaviors that they were experiencing from their teens. So we know at no other time except during the first 2 years of life, from when those teens were born up until 2, will they physically change so dramatically. So between early and late adolescence, growth in height averages about 8 inches and weight about 45 pounds. Some of the things to watch out for during physical development is fear and withdrawal, especially in early adolescence. So you'll see quite a range of development in early to middle adolescence where friends will look very different from each other physically during that time period. Them having an obsessive concern about their appearance that causes them to miss school or events because they didn't look right. So a lot of teens will be concerned about their appearance, but when it takes it to the next step of not attending school or an event, then that's something to watch out for. Excessive dieting or exercise, and then being bullied, teased, or excluded by friends, particularly on social media, which makes it really difficult to find out that that is happening. Cognitive development, or their thinking skills during adolescence, they go from being concrete thinkers in early adolescence, and you can see my little cartoon example here of concrete thinking in early adolescence, all the way through late adolescence where there's more abstract or thinking about the meaning. Many of the things that frustrate parents of adolescents are a normal part of their development. So part of their cognitive development is to argue for the sake of arguing. So teens are arguing with parents and others all the time. They're jumping to conclusions. They're very self-centered. They constantly find fault in adults' positions on things, and they're very dramatic. So all of these things are a normal part of their development. And we've created a handout that provides some brief information about each of these behaviors that I just mentioned on the slide previous as they relate to cognitive development, and then some suggested responses for parents or how to approach their teen when they are feeling some of these different things and displaying that. And just knowing that these behaviors are normal can help diffuse parents' reactions to those and their responses, which is kind of the first step in communicating effectively with teens. So again, you'll find all the handouts that I'm referencing in the GoToMeeting box and on our website, which will be included at the end of the webinar, the link for those. So some key emotional development indicators in teens is that they are becoming more independent. So now we're talking about their emotional development. They're developing close relationships with people outside of their families, and that can cause stress at home, especially parents that are having difficulty kind of letting their teens go and kind of experience life without their management or oversight. And then they're also developing an increased need and capacity for intimacy or deeper friendships, maybe some love interests. That's normal. So emotional development, also some things to watch out for as your son or daughter develops emotionally is that they don't have too much focus or concern about their bodies, that there are changes in eating or irregular meal patterns, if you notice those, if they're losing sleep or have trouble sleeping, although sometimes it can be difficult if they're using their phones or technology late into the evening, and then just kind of ups and downs of relationships that never seem to end. So they're always in this rotating. So some of the key sexual development indicators: development of physical sexual characteristics that you would expect, like enlarged breasts for girls and penis and testicles for boys, some age-appropriate sexual behaviors like kissing, having a formulating their positive sexual identity, and then a sense of sexual well-being. So these are all indicators that they're moving forward in their development. So some tips for parents is to help them understand that teens are going through so much change so quickly, and it's really related to their physiology, their development. So they should be going through physical, emotional, cognitive changes. And that growth spurts will time. So while your teen might develop physically, by middle adolescence, their cognitive emotional development may still need to catch up. So they might look like an adult, but they're not necessarily thinking like an adult, and their emotions are kind of going crazy. So a lot of times other adults expect them to behave in a way that they look when really they're not there developmentally in all of the stages. And then understanding exactly what is happening during adolescence can really help parents during this physically and emotionally challenging time. A lot of parents don't really understand those changes. So what we've done is created kind of a handout that walks through each of these stages of development: early, middle, and late adolescence, and some of the changes that they should see in each of those stages. So it's helpful for them to kind of have an expectation for how their teen might respond or how they might behave based on kind of where they are in their development. Just like when they were born, they got a lot of information on what to expect at 2, 4, 6, 9 months, that sort of thing. It's very similar idea to that, and a lot of times they don't see those kind of things. So moving forward with kind of motivational interviewing versus standard approach. Motivational interviewing is a communication strategy that's been studied extensively and shown to be an effective approach with teens to reduce risky behaviors. So it moves from telling teens what to do, because we know that increases their resistance, not just giving them information, but allowing them to kind of think through different behaviors and how they might respond in a more positive way. So if we look at motivational interviewing with adolescents, it's been shown to decrease substance use, risky sexual behaviors, to facilitate healthy eating, increased exercise, reduce stress, and has been shown to have fewer injuries and hospitalizations for teens that have participated in some motivational interviewing sessions. So as professionals, we should try to seek out some type of training in these communication strategies so that we have an understanding also of what strategies are most effective when we're working with teens. So the strategies, if you're not sure what they are, I'm going to review them very briefly. So they're kind of the basis for coaching parents on communicating effectively with their teens, using open-ended questions, affirmations, reflections, and then kind of summarizing what you hear. So if we're talking about open-ended questions, everybody knows what those are, questions that start with kind of these words here, who, what, when, where, how, and sometimes why. You just have to be careful with that. But a lot of times they just give you one-word answers. So you want to kind of move towards fully open questions, like question starters like, what do you think about? So you might say, what do you think about texting and driving? So that you get an idea of where they are in potentially engaging in that behavior or wanting to not engage in it. Maybe tell me about, that's an easy question starter. How do you decide when to, if you're talking to a teen about condom use potentially, how do you decide when to use a condom and when not to? How do you feel about something, or help me understand? So all of those will get a longer response than a one-word response from teens. And then key questions really help move teens towards positive behaviors or behavior change. So they might be used after you've talked with the teen about a particular situation or a particular behavior, and you can summarize that, like, given what you told me, what do you think you'll do next? Where would you like to go from here? What if you tried? So there might be some ideas that you have that you want to give them, or what would it take? So what would it take for you to stop using marijuana if you're talking about that? Just to get an idea of what they think they could do. Affirmations are really statements that recognize teens' strengths. So those can be used to encourage, like encourage healthy behaviors, obtaining goals, to build relationships, to really ensure healthy self-esteem and self-worth. It's really important to affirm strengths to support positive decision-making, because teens with low self-esteem are more likely to use substances, engage in unsafe sexual activity. So we want to build teens up versus tear them down. And affirmation statements are not I statements. So we may have learned as professionals to really say I feel like this when we're talking with our clients, but really they're you statements. So putting it kind of into context, if I was your boss, say, and I said to you, I think you're really good at your job, or I said, you're really good at your job, which one of those makes a bigger impact on your self-esteem? So it takes it away from me thinking that when I say I think you are versus you are, it's a more powerful statement. So when we're talking with teens, when we're giving them some affirmations, we want to try to use you statements. So one might sound like, you have the support you need from your mom and dad to make this happen. So they feel like they know it's recognized that they have support. Or you're a dedicated friend, or you're a good student. You are is sometimes the easier one to use when you're talking about affirmations. You might say something like, you feel in control of your schedule now, or you feel in control of your medications now, or your health, or you believe you can stop smoking. So it's all affirmations that you want to make that build them up and make them feel like, yes, these are strengths that I have. They don't need me to say, I see it, and then say it. They actually have it inside. And reflective listening is one of the most valuable communication skills and the most difficult to master. So it involves really actively listening to your patients or your teens, stating back to them what you heard rather than asking questions, and then adding an emphasis or some type of additional meaning or continuation of their thought. So it's an active process. You're deciding kind of what to state back to them, what to ignore, what to emphasize. Kind of an example of that you can see here. So if you're talking to a sexually active teen in your practice, you've kind of gathered their history, you're listening to them, you might state back what you heard. You've had sex and not always used protection. Just as a generic statement, no inflection as a question. And then you might follow up with a statement that's a continuation of their thought. So we're making an assumption. You're looking for ways to keep yourself and your partner safe. So that would lead the conversation towards them telling me what they feel like they could do. So instead of asking the question, what do you think you could do to be safer, I'm making a statement that does similar things, but is really putting it on them like, yeah, I am looking for ways to keep myself safe versus me asking them what they should do. We're getting to the same place. It's just the way we're getting there provides them with more direction. They're leading the conversation more than you kind of continually asking them questions. So if you want to learn more details about motivational interviewing or how to put it into practice, really motivational interviewing helps improve identifying risk behaviors, communication, and has really been shown to help motivate adolescents towards positive behavior changes. So there is an opportunity for you to do an online interactive learning module. These modules are no cost, so I'm sharing this information. The website here is where you would go if you're interested in that. I believe if you want the CE or CME, there's a processing fee for that. And then I would suggest if you do go to the online modules and work through that resource, that you find some online workshop or on-site workshops that will help translate that knowledge into practice with adolescents and parents. Motivational interviewing is just a really good way to communicate no matter who that's with. So we're talking about engaging and partnering with parents. We've kind of had some background around why it's important and some motivational interviewing skills. I want to try to do a poll. We'll see here. So the first question is, how often do you counsel parents of teens on normal adolescent development? If you see the poll, if you can respond. Yep, and I see that people are responding. And it looks like about 20% never or rarely, about half, 46% occasionally, and 16% often. And then we have the minority, about 18%, either most of the time or every visit. So that's good to hear. And then the second question, how often do you counsel parents of teens on effective communication strategies? So how do you talk to your teen in a way that's going to build a relationship that is effective in reducing their risky behaviors potentially? So you should be able to see that poll now. Because I think that's probably one of the more difficult things to counsel parents on, is just communicating with teens. So for this question, about 70% either never, rarely, or occasionally talk to parents about communicating with their teens, about 17% often, and about 13% most of the time or every visit. So I'm hoping that I have some resources and materials that you can use to improve this number over time in your practice. So thank you for participating with that. Well, we know that teens are among the lowest utilizers of healthcare and getting services outside of their home. So it's really a no-brainer to include parents in the effort to reduce adolescent health risk, because that's who they're with most often, along with everyone else, their peers and teachers and things like that. But if we're talking about supportive adults, parents would be the ones that they're with most, hopefully anyway. Yet there's really this kind of push-pull that happens when we're working with parents of adolescents in our practices or in our programs, because when we're screening or counseling a teen on the risky behaviors during an appointment, it's essential to have kind of that private time without a parent, and it can cause some concerns and generate questions from parents. So it makes us sometimes feel uneasy or unprepared on how to deal with their questions. So we've developed a tip sheet, which I'll show you on the next slide, with responses to some of the most common parent questions. So you can take a look at that. You can use it. You can use it just for your own reference or to hand out to parents if you need to. But what's really important is that this is an opportunity when parents do question your time with teens without them, not just to explain why adolescents need that time and kind of that confidential space to take care of their own health and to talk with you about any concerns they have, but also a time to provide parents with some of the coaching tools that they need to engage their adolescents at home. So giving parents the tools they need to connect with their teens, it'll help support those positive behaviors and reduce risk, maybe even more than the time that you have directly counseling teens, because the parents are with them much more often than you are. So it's really important that they also understand and have some ability to talk with their teens in a way that's going to help connect them. This is the document that I was talking about, some frequently asked questions about risk screening, particularly the RAPs, but you can use it as a resource for any other screening that you're doing as well, and just kind of responding to parent concerns. We know that family closeness and attachment have been shown to be one of the most important factors in leading teens to less drug use, delayed sexual experiences, and fewer suicide attempts. And those are really critical issues in adolescence. Some of the ways that we can help parents build relationships is just reminding them to try to keep family time a priority. It's very difficult with teens. They have a lot going on typically with sports and clubs and music and friends, but to really find time, maybe not every day, but it might be as simple as watching a show that they want to watch, being in the same room with them, having one night that you have dinner together. If it can't be, during the week, maybe on a weekend, or you're in the car, maybe you're driving them to school or home from school. So it doesn't have to be an extended amount of time. It can be very short times too. Really listening. So I think that's one of the biggest barriers. It's a more want to tell our teens about things that have happened to us maybe and how it relates to situations that they have to deal with, or give them our life experience. And it's really important to be able to listen to teens and hear what they have to say without kind of butting in with those stories and that information. There is a time to share that, but maybe towards the end of your discussion with them and not right away when they start talking to you. Because people in general aren't listened to very often, but especially teens. So when you really listen to them and let them know that you're listening by using reflections and some open-ended questions, it really opens them up to hear what you have to say. And then guidance. So I've put together 5 tips for parents and coaching parents in communicating with their teens and really helping guide them. So the first one is establishing kind of that mutual respect. So when you have a two-way discussion with a teen and not a one-way discussion at them, you're really building a relationship with the teen where they feel valued and respected. And when they feel like that, they're more open to sharing things with you when they're having issues, and also to hearing what you have to say as a parent. So you really kind of set the stage by asking permission. So before you jump in and tell the teen what to do, start with a phrase like what I have here. Can I share something with you? And just the act of the teen responding with yes. So most of the time they'll say yeah or I guess. So they won't be jumping for joy to say I can't wait. But the act of them saying yes will cause them to be more open to actually hearing the information that you want to share because they were asked permission to begin with. And then showing empathy. So maybe when they get home from school, you might say, you had a hard day at school. And it'll help them feel kind of understood when you're seeing that in them, and before you just start talking to them. So if you're thinking about wanting to talk to them about avoiding risky behaviors like drinking alcohol, you know they're going to a sporting event and then everyone's going to someone's house after, and you know it might be a situation that there would be alcohol involved, you might start with an empathetic statement, something like what you see here. It's hard to say no when your friends are saying yes, and I know you're committed to not drinking. So it lets them know that you understand, like it's not just an easy thing just to say no, and can help to open the door to a real discussion about peer pressure and what they might do if they're offered alcohol. This is an example, tip 2, talking with and not at your teen. So these are examples of using a lot of the motivational interviewing strategies that I just reviewed. Motivational interviewing is a great way to communicate that gets teens active in the discussion and not just a passive listener. So a lot of times teens are like, yeah, if you're saying don't text and drive, don't have sex. But when you reverse that and talk with them and say things like, what would it take for you not to text when you're driving? Or having sex is a big decision. I care about you and hope that you'll wait. It feels a lot different and engages the teen to respond to what you're saying versus the sentences that you see on where it doesn't sound like talking. It's talking at instead of with. So there's some other examples here around some common things that parents may say or adults may say to teens related to different behaviors. The last one, we need to talk. A lot of times when people say that, you're automatically like, whoa, I don't know what that's going to be about. So you might talk with a teen by saying, I'd like to talk to you today without any distractions. What would be a good time? And then they're also having the opportunity to tell you what works for them, so they'll be more open to the conversation when it comes up to that time. So lots of different ways here. Tip 3, we're coming back to kind of that affirmation idea, so fostering self-worth and self-esteem. So teens that are told or they feel like they're not good enough are more likely to use substances, report depression and anxiety, have sex at an early age. So if we focus on keeping a positive view of teens and share the strengths we see in them, it really will help them overcome some of those common risky behaviors and situations that they might engage in. Because teens will live up or down to our expectations. So if we're talking to them all the time about how bad they are or what we want to see different in them versus what strengths we see, they will kind of fall to that negative self-perception. So we want to empower them to take care of and value themselves. So if they feel like they're in control of their decisions, they're planning for risky behaviors, that gives them a higher self-esteem. It'll increase the likelihood of them not engaging in unsafe behaviors. So the more a teen believes in their ability to make and sustain a change in their behavior, the more likely they'll be able to succeed in that. And then we want to reflect strengths that we see in them, just like in the affirmations that we went over already. We might even say something like what you see here. So some people give up when it gets hard, but you're able to use tough times to grow stronger. Tip 4 is listen. So we're coming back to listening. So as a parent, it's really important that they can facilitate conversations and not always lead them. Not that they will never lead conversations, but to help facilitate them is really important. Ask questions to get teens talking. Try not to interrupt with personal stories, that sort of thing, like I mentioned earlier. So as a parent, when you're talking to your teen, when you want to respond immediately, you want to say something or add a story, what I suggest is just take a slow, deep breath instead. Like let your teen finish their thought and kind of facilitate the conversation. And you can weave in your story if it's appropriate, but try not to respond immediately and take that over. The teen should be doing more of the talking than you are. And you can use really simple statements. So try something like this. Parents that I've worked with say that this is the easiest thing to incorporate and really made a huge difference. So when teens came home from school, they were like, tell me about your day. versus what we typically might say when we see our teens come home from school, like, how's your day? What'd you do? That sort of thing. So when we say, tell me about your day, it causes them to think like, what do I want to say? Versus our typical response, people are asked, how was your day all the time? And we might say, fine, good, or, it wasn't so great. But tell me about your day really makes you think, what am I going to say to this and what do I want to share? So it might be an easy step. And then if teens are talking about a situation that happened at school maybe, or something related to what they saw on TV, try to listen to them and draw out what they think about that situation. What are some safer behaviors? You might summarize what you heard them say and then ask an open-ended question. So that sounds like a really messy situation. What would be your reasons for waiting to have sex? So if it was something around a sexual situation that happened. But you can put any behavior in there and use the same kind of sentence. And then the last tip is really slow the impulsiveness. So we know teens are very impulsive, so we want to try to slow that down as much as possible. And if you look at studies, and even studies of brain chemistry, if teens have the opportunity to kind of talk through some common risky situations, and maybe that comes up when you're watching a TV show with them or something that they're sharing with you that happened at school or you see on the news, kind of talk through that with them. Have them think about different ways they would handle a situation and what they're likely to do when they encounter those situations, because they're going to, at some point, encounter different situations where they're going to have to make a decision. And if they've thought about it ahead of time, they're more likely to follow through with that plan that they thought about than if they haven't. They're more likely to just be impulsive and be influenced by peers or the situation. So you want to make sure that you're kind of following that process. So you might ask about the behavior, really listen, then ask them a question like, tell me about, and you can plug in the behavior. Listen to what they have to say, their reasons. You might respond with, what are your biggest reasons for waiting? If we're talking about sex, or what motivates you to use protection every time you have sex? And then end with that key question, like I was sharing earlier in the motivational interviewing strategies. What do you need in order to make this happen? This is an example of kind of putting those 5 tips together. So starting out with asking permission, waiting for your teen to respond, and then using some empathy. It can be really hard not to look at and respond to texts when you're driving. Really trying to empower them. You care about being safe and keeping your friends safe when they're riding with you. Let them respond to that. See what they have to say. And then you might follow up with a question like, tell me what you think you could do to keep from texting and driving. Listen to what they have to say. You might offer some solutions of your own. So if you want to offer solutions, you might try to summarize, like, those are really good ideas. What do you think about putting your phone in the glove box or putting it on do not disturb when you get in the car? So then you're sharing some of the things you want to kind of think about that and tell you what they think. And then end with that key question, like, what can you commit to doing? Because we know that texting and driving is one of the biggest factors that put teens at risk. So the 5 tips that I just talked about are incorporated into this one-page document. So if you want to use that document as you're counseling with parents, helping them kind of walk through different strategies, it's also one of the handouts. You can give it to them. You can use it as kind of your guide as you're talking through these different things. So all of these things are meant to support kind of your coaching parents in some of these basic strategies. So some of the resources we've kind of talked about, I've interspersed them into the webinar. The parent handouts, again, they're all in this GoToMeeting panel, as well as at our website at this webpage. So if you go to possibilitiesforchange.com, parent engagement, you'll find all of these handouts, the ones that are included in the GoToMeeting panel on our website, so you can download those and use them as you would like to. All of the parent resources and the information that was provided or included in this webinar came from my book, Teen Speak. So Teen Speak was really born out of my motivational interviewing trainings with health professionals. So when we were involved in the trainings, many of the professionals were sharing with me that the training really helped them connect with their own teens and communicate in a more positive way with the teens they had at home. So I thought, wow, if professionals needed help with that, and they've had a lot of education and experience working with different clients and teens as patients, how are parents with no training getting information? So I wanted to put something together that was really kind of a how-to guide. So it's more like an instruction manual for establishing strong relationships that support real talks with teens about risky behaviors, but also about behaviors that you might talk about every day, like managing your schedule and keeping things on track and being responsible. So that resource is also available in the handout, some information. So I appreciate your time and interest in learning some new ways to maybe partner or coach with parents around reducing adolescent risk. Over the next year, 2017, we're going to be putting together additional resources, potentially some online modules for parents specifically in practicing some of these communication strategies online using a technology kind of virtual environment versus practicing with their teens, but that's also fine for them to do. So we'll be working more around parent engagement and resources for parents over the next year. So if you have questions, please let me know. My email is here and also my phone number. So we'll be sending out this webinar to everyone that was registered following, the recording today, so you'll be able to refer back to it if you need to. And if you have questions, please go to the question box and type those in. So there's a few questions. One, the responding to normal teen behavior seems very negative when addressing the teens. So wouldn't that add negative connotations to the adult's reaction? So actually that piece has been what parents love the most, because they're super frustrated and feel like they don't know how to handle their teens when they're displaying some of those behaviors. So if you look at the handout, you can see each of those behaviors are listed because they're very common and things that parents get really frustrated and have difficulty dealing with, and then it affects the relationship. So next to it in the text is really like, this is a normal behavior. It's a more positively focused response versus kind of what they're used to seeing and how they feel about it. So it's kind of a contradiction on the handout, but you're right, it's very, very direct in this is what you're experiencing. And the parents that I've worked with have really related to that immediately and then been open to, okay, here's how to diffuse yourself, here's how to handle that situation or how to respond to that in a way that would help diffuse your teen. So it is normal behavior. And yeah, I understand what you're saying there. Another question, we do parent nights all the time with our peer education team. Thank you for the presentation. This was very helpful. So yeah, please use handouts and have discussions with parents. We're going to be putting together kind of a training that professionals could use for parent nights and other things related to the Teen Speak book and the different concepts that are in there, which is what those handouts were developed on. So if you have any other questions, if I didn't see yours for some reason, please let me know. You can email me and I'd be happy to send that to you. Thank you very much.